Greetings from Citizen Health and the Team Academy IAPS and Me Connect. And today, in the series of People's Health It Matters, we have Dr. Clarence Samuel, who is a professor, HOD, Vice Principal in CMC Ludhiana, Department of Community Medicine. A very warm welcome to you, sir, on behalf of all the audience.
Thank you for having me on.
And today we are going to talk on a very interesting thing, medical myths. So without wasting any more time, sir, I just start my first question that what are medical myths?
Medical myths are myths that doctors practice without actually having the evidence for it. So someone has told us that, you do it this way, and we continue to do it the same way without really questioning why was it done? Is it still relevant to be done? No, do we continue doing something just because some learned senior guru had told us about it? Okay, and is it relevant today? So if we continue to do something which does not have, technology has changed, diagnosis has changed, and we continue to do something that way, then that is a medical myth.
Okay, so can you please explain, sir, with some examples?
Okay, for example, we take the history of allergies. And if you look at anyone who has to undergo a contrast study, X-ray with contrast, everyone's really worried. Oh, he has a history of allergy. Oh, he has a history of allergy with fish or with shellfish. And then everyone, we start over treating. We give pre-meds much earlier. We're very tense. We're very worried. We have more palpitations than everything else. The myths for that is earlier, many of the contrast, this one were, they're supposed to be iodine. So iodine is supposed to be rich in shellfish, and that was the association. But the people who are allergic to shellfish are not allergic to iodine. Iodine is everywhere, and it's not just in shellfish. So why aren't they allergic to other things? And we continue to say, oh yes, allergic to this one, iodine dye, be careful. But the people who are allergic to shellfish are allergic to the other proteins that are there. So that is a medical myth that we have. We have a whole lot of things there. And this is one of them. We have our own set of myths which we continue to treat.
Okay, so if one has to clarify if it is a true or a myth, how a person can clarify it?
Well, as people of science, we should continue to question, even if it is something that is told to us. We need to continue to question and look at the basis of why it was done and see whether it is relevant now or not. At one hospital where we were working earlier, one of the people over there decided to put a, this is when we start with the biomedical waste color coded bags. They decided, okay, there's going to be blood on the wheelchair, so let me put a yellow bag on it. And before you knew it, everyone started putting yellow bags onto this one. And no reason. Someone just said, okay, there was blood. And so you have like these practices that people pass on without really knowing why. And as people of science, we should question and say, okay, is this relevant today or not? Technology has changed, things have become better. Okay, but there are certain practices that we have are not relevant or rooted in evidence for the present.
So being a common man, common public, if any curiosity comes in my mind, should I ask to the medical practitioner or should I just keep quiet or just follow the things?
Medical myths, two ways. The medical practitioner also has to clear their myths. They should go back, look at the evidence. Because if we are confused, and when the common man comes to us, we are going to give them, conflicting suggestions, which will create doubt or affect that trust that they have in physicians, in medicine. So it's important that we are clear with our facts. We know what is rooted in science and then logically deal with. Tell you one thing. When it rains, what is the most common uh, reaction that people have traditionally? When it rains, what do we want to eat? Okay, so we want to eat fried foods normally with rains. And why is it so? The fact, people say, no, 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 you should not eat fried foods. It doesn't make this one. Now, that's again a myth. Because when it rains, it becomes cold. When it becomes cold, your body needs energy. And where do you get your energy from? You get it from food. And which is the best source of energy? The oil that you fry your pakoras in. So the traditional knowledge is there, and our myths are there, like, this is bad, this is good. But we need to understand why. What is the science behind it? That is what medical myths is all about. Thank you.
So it's not always a disadvantage, no? It is advantages also that, like as you have said, that in rainy season we want to eat pakoda or the fritters. So it is an advantage ki if we follow the myths, we will go to get energized our body.
Yes, we should know the science behind it, because if it is, we have our traditional knowledge with regards to hot food, cold food, and someone says nothing like that. You can eat watermelons in winter also. Okay, you can eat grapes in winter also. You can eat this one, but there is a reason. There is a season, and there is a reason. You can't be eating rich, oily food in summer. You would feel most horrible. But if you eat this rich, oily food in winter, you would you would not feel so horrible because your body needs that energy. And especially up north, where it becomes really cold, you have all the more food that are rich in ghee and rich in fats and oils for that season. So medically, we need to give proper advice to our patients. We need to give proper advice to our community, and we should know the basis why we practice medicine.
Thank you. Thank you so much, sir. It was really interesting talk with you. Thank you so much, sir.
Thank you. Okay. Have a good day. Bye.
Okay, sir. Bye.